All right, good morning, everyone. Welcome to Pediatric Grand Rounds. This is Dr. Parmeshwar. As part of our trauma-informed series, it's my pleasure to welcome Christina Rouse as our speaker today. Ms. Rouse is the Program Director of Children's Advocacy Center and the lead forensic investigator. In her role, she manages the day-to-day operation of CAC at the Children's Trust and the multidisciplinary team of investigation. Prior to that, she was a child protective social worker with the Radford City Department of Social Work. She completed her education as a graduate of Virginia Tech with a BS in psychology. She completed a master's in social work at Radford University, as well as extensive training in forensic interviewing techniques, investigation and prosecution of child abuse. She holds numerous positions at CAC, and also serves as a faculty for the Child First Forensic Interviewing Training Program, where she teaches the course to CPS workers, law enforcement, and prosecutors across the state. Please join me in welcoming Christina Rouse.
Thank you so much for having me this morning. And I know it's a little early for a pretty heavy topic, but I really would appreciate if you guys have questions, ask them. We are going to have some time at the end, but if you think of something as we're moving through the presentation, just drop it in the chat and we'll get to it. So this morning, we're going to spend about an hour talking about how you as a professional are going to be hearing children's disclosures, and then also as a mandated reporter, what you need to do to ensure that that disclosure is handled in a trauma-informed manner, but then passed along to the appropriate people so that an investigation can happen. And the reason that we're focusing on handling disclosures in a trauma-informed manner is because we always need to be thinking about, especially mandated reporters, is what happens in the end? What am I doing now that could affect the end of this case? And so handling a disclosure in a trauma-informed manner will hopefully set up the case to succeed, rather than barriers be put in place because of not understanding how the investigation works, or really meeting a child's disclosure with disbelief. So we're going to talk about all of those things. We're going to talk about how children disclose abuse in the process that they go to, because not every child is the same, and then how they process their trauma. And we'll spend a little bit of time explaining how cases are currently being investigated in our community and what that looks like. So this is just my disclosure. I find it really important that if we're going to be talking about disclosures, we need to talk about the data that we're seeing currently in our communities. So this data is from this last fiscal year, so June to July of 2018 to 2019, and gathered from the Department of Social Services. And all of this information is public knowledge. You can go onto their website and find a lot of data. If you like data and research, I would implore you to do that. If you're curious about the numbers that we're currently seeing, I think the time that we're in right now with COVID and the pandemic, these numbers are going to look drastically different, just because kids are no longer in front of mandated reporters in the manner that they used to be pre-COVID. So I'm fascinated to see how the data and the research crunches out from this. But in a nutshell, basically 1 in 18 children are going to experience some form of abuse, specifically sexual abuse, before they're 18 years old. So 1 in 10 children before the age of 18 will have some type of encounter. And they used to say 1 in 3 girls and 1 in 4 boys, which is still a true statistic, but the 1 in 10 kids I find much more profound, because we can all think of 10 kids in our lives that we know, and the likelihood that one of them is going to be abused before the age of 18 is pretty concerning. Last year in the state of Virginia, over 58,000 calls of abuse were made into the Department of Social Services. And we're going to talk about being a mandated reporter and what that responsibility is for you in your profession. I think it's imperative that all adults in our community should be mandated reporters, whether we have a profession that dictates we need to be or not. But it's really our responsibility to ensure the safety of the kids in our community. Of the 58,000 calls that were made into DSS, about 5,000 of them were specifically related to sexual abuse. So throughout my presentation, I'm going to be talking a lot about child sexual abuse. Most everything that I cover today can then be transferred to any type of abuse on a child: physical abuse, neglect, emotional abuse, medical maltreatment. But my area of expertise is sexual abuse, so we're going to hit a little higher on those points. But just know you can use this information in regards to all kids who've suffered all kinds of maltreatment. Based on the numbers that we're currently seeing, you can see the graph and just the data that's broken down. If you're curious about the NRV localities, that includes Radford, Montgomery, Pulaski, Floyd, and then Carroll, Grayson, and Galax. So that's why their numbers are pretty high down in that area. If you're surprised by the numbers that you're seeing, drop it in the chat if you think they are higher than you thought they would be or lower than you anticipated. I think the big thing to take away from the data is the number of calls that are being made into DSS in a given year. So when we're talking about abuse and we're talking about how children experience trauma, in regards to sexual abuse, it's the most underreported type of abuse. And there's a couple of reasons why that is. The first thing is that it's very secretive in nature. A lot of times when you have other forms of maltreatment, there are things, especially physical abuse or neglect, those are things that are pretty out in the open. There's a lot of evidence around it. Sometimes there's a lot of witnesses to being able to see things. But in regards to sexual abuse, there's typically only two people involved, the victim and the perpetrator. And it's usually never done in front of other people unless someone accidentally walks in or discovers a video or recording. So there's hardly ever any people around, and it's very secretive in nature. And the other thing is that it's also intrafamilial, meaning that more than 90% of our perpetrators in regards to sexual abuse are family members, typically parents or caregivers or immediate family, aunts, uncles, grandparents, things like that. So if you think about children in your own life and people who have access to them, they're at pretty high risk of being around a potential perpetrator because more than 90% of them are family members. And then it also has numerous layers of emotions in regards to the types of abuse that they're getting. And not only is it physical because of the things that are happening to their body, but it's emotional, it's mental. There's all kinds of things wrapped up in sexual abuse. And there's also this stigma about it. More than likely, children typically don't ever disclose about sexual abuse. It's a type of abuse that carries a lot of different connotation with it. And so if you think about being abused by someone in your own family and then having to report that and what those consequences might be, to a lot of kids, it's just easier to keep it a secret. And we're going to talk about the barriers around why some kids don't disclose. We have cases that our team members are working now where adults are just now disclosing about their abuse as a child. So sometimes it takes years for people to disclose about abuse. And so I think the biggest thing that you should take away with how children process abuse and trauma is that not every child is the same. Every child is going to do it in a different manner, and it's going to look different, and the timing is always going to be different. I hear a lot of feedback from community members when we've been working cases that say, well, why didn't they tell right away? Or what took them so long? Everybody processes trauma differently, and some people just need more time, and some people just don't tell at all. So when a child decides to tell, if they decide to tell, I think the rule of thumb is that telling is the exception. If a child discloses abuse, that's the exception. Non-disclosures are typically the common rule with kids. So if you're in a situation where a child does disclose to you, that's pretty important, and it's a pretty pivotal moment in that child's process of disclosing at that time when they actually decide to tell. So there's two types of disclosures. There's accidental disclosures and there's purposeful disclosures. Most often our disclosures are accidental. Kids rarely cognitively decide to make the decision to tell an adult about their abuse. Usually it comes out in some accidental form. they're playing with toys or dolls or other things, and they make a comment along the lines of, this is something me and my dad do, or this is how so-and-so touches me. It's not a purposeful disclosure. It's just a comment they made that rose alarm in someone else or suspicion that made them make a report. Other accidental disclosures are if a peer is talking about maybe their own abuse and a child says, well, that happened to me too. It's not really purposeful. It's just kind of a comment. A purposeful disclosure comes from a child who cognitively makes the decision that they want to tell somebody else about their abuse to make it stop. Typically, we don't see this a lot in our young kids. Purposeful disclosures usually come from our older teenagers. The accidental disclosures are typically from younger children under the age of 11. So just knowing on the onset that most likely kids don't tell, and if they do tell, it's usually an accidental disclosure. And once a disclosure is made, there's all different stages that kids are going to present as, depending on where they are with processing their trauma. If you have a child who is not ready to talk about their abuse, let's say they made an accidental disclosure, and then someone inquires about that, they're more than likely going to be in the denial stage of disclosing or in the tentative stage of disclosing. Denial is pretty obvious. These kids, when asked about something, will say no. They're so much in denial that if you were to ask them if the sky was blue, they would also still say no. And it's important that if you see these kinds of behaviors in children where they're in denial or they're super tentative, that's them sending you a message that they are just not ready to talk about their abuse. And any further inquiry or further pressure, whether it's from professionals or mandated reporters or even caregivers, could put the kid in a place of being, we're inflicting more trauma on them by making them tell us if they're not ready to. Kids who are in the active phase of disclosure are typically the ones that make the purposeful disclosure, right? They made that cognitive decision that they're going to tell. They've sought someone out. And when they do tell, they tell everything, or at least as much as they're able to tell in that moment. I think the other thing about disclosing is that it's a process. It's not a one and done for kids, just because the way we know how trauma is encoded in our brains and how those memories are then retracted and retrieved out of our brains, disclosing can take years. It's not unusual that we work an investigation and a child makes a disclosure and then they're put into counseling and receiving mental health treatment, and then they continue to disclose additional information after that. So the active phase of disclosure or the stage of disclosure is a very rare one. I think less than 17% of kids are in the active stage of disclosure. We are usually dealing with children who are in the denial or the tentative phase of disclosing. Kids who are in the recanting stage have made an initial disclosure, and then for whatever reason, after a period of time, then retract that initial statement. So they take it back, they recant their disclosure. And what I'll say about children who recant disclosures is there's always a reason for the recantation. And it's not because the child made it up. I think a lot of times we, especially with our older teenagers, we get the impression that if their initial disclosure is told and then recanted, it's because they lied about what happened to them. In regards to specifically sexual abuse, it is very rare for children to lie about a sexual abuse encounter if it's provided with a lot of sensory details, a lot of peripheral information. And the reason I say that is because if you have a 5-year-old who's talking about and disclosing about a sexual encounter with a lot of sensory details, what they saw, what things smelled like, what things tasted like, and they just don't get that from other areas in their life, right? Typically, young kids who make pretty credible narrative disclosures only got it because it happened to their body or they saw it with their eyes. And so recantation happens A lot. We work a lot of cases where kids have made disclosures, the process has started, investigations are happening, and then they take it back. And we'll talk about the reason children usually take back their disclosure. And then there's kids who reaffirm. These are the kids who've disclosed, they've recanted, and then they've come back around to reaffirm their initial disclosure. These cases, through the investigation and specifically the prosecution process, are really hard to move forward with because it just opens up so much doubt in the court's eyes and a jury's eyes in regards to whether or not the child was credible about their disclosure. But if you're thinking about how a child is processing a trauma and all of the things that go into what happens once a disclosure is made, of course the child might take it back. For example, let's say I have a hypothetical child, 10-year-old, disclosed that dad or uncle was sexually assaulting them. Let's say it was dad. Makes an accidental disclosure to a friend. Friend tells their mom, that mom makes a report. Child's in the tentative stage of disclosing, is kind of alluding to something happening, but not giving a lot of details. Understands that if they do decide to tell against dad, dad's going to have to leave the home. Dad's the only one that works in the home. And so once dad leaves the home, how are we going to get any money? If we don't have any money coming in my home, I'm not going to be able to participate in my sports activities. And then maybe dad goes to jail from that. Who's the person that sent dad to jail? Oh, I'm the person that sent them to jail. So now I have all of this guilt and shame. And maybe mom is supportive of me, but cries all the time. And I see her very upset. And so now my whole world is turned upside down because of one thing I said to my friend. And so I'm going to take back my disclosure. So it's not unusual for this process to look messy or confusing or something that we as adults might not understand because we didn't experience that trauma. So it's important to know that every child's going to look different. They're going to disclose differently. They're going to act differently when they disclose. There's no such thing as like, oh, they look like an abused child or they're acting like an abused victim. That's just not how we need to be approaching these kids, especially our teenagers. I can't count the number of cases where teenagers have disclosed and they end up disclosing after some form of a disagreement or an argument or them getting in trouble. And it's because they're just done, right? They're just fed up and they're done. And so they tell out of anger for whatever reason. And their, trial by public is that, well, they're only saying that because they had their phone taken away, or they're only saying that because they got grounded. The teenagers, I feel like the community and the public at large do them a huge disservice in regards to when they disclose, because they try to come up with all of these other reasons of why they're disclosing, rather than just taking the disclosure as it is and investigating it from there. So when kids experience trauma, again, there's so many layers that go into how they're processing those emotions and these feelings. But there's two different models that happen with experiencing trauma. There's the child sexual abuse accommodation syndrome, and then there's the traumagenic model. They're both very similar. What I'll say about the child sexual abuse accommodation syndrome is that it's not a syndrome in the sense of a diagnosis. Someone can be diagnosed with having this syndrome. So I felt like that the word syndrome is a little misleading, but it's basically just explaining how kids move through the different emotions and some of the emotions that they might be experiencing having been affected from a trauma. In regards to abuse and neglect, the secrecy around what has happened to them is huge, especially sexual abuse. Helplessness, entrapment, delayed disclosure is a huge part of it. And so these things might come out in a child's behaviors, or let's say part of their abuse scenario or their abuse victimization. So entrapment, you might have an older child who was abused by their father every time their mom went to work every other day. And by the third or fourth week, As soon as their mom leaves for work, that child goes upstairs and gets in their bed and waits because they know what's going to happen. And so they're feeling entrapped in their abuse and not having any control over what's going to happen to them. So they just start going through the motions because it's easier rather than putting up a fight or arguing or disagreeing or anything like that. So it may look like they were compliant with the abuse when really they were just feeling helpless about it and trapped in their own abuse scenario. So we need to think about how it might be portrayed to us who haven't experienced that trauma, and not try to read into it or dissect it because we didn't live the trauma. We weren't in their shoes. We don't know all the details around it. And so things might look a little confusing to us as adults and we might not understand it. And that's okay. But we can't meet a child's disclosure with disbelief. I think that's the biggest thing for the people in our community, adults, professions, mandated reporters, is that our job is to hear disclosure, and if we're suspicious about it, to report it. And it cannot be met with disbelief, and I'll talk about why in a minute. So our blocks to a disclosure, why kids don't tell? I mean, there's a lot of reasons why children don't talk about abuse. I think the biggest thing is that it's scary, right? It's the unknown. If I tell, what's going to happen? And for a lot of people, it's just easier not to talk about it because I can handle what I do know and I can anticipate that and I can manage that and I have tools in place to get me through that. I don't if it's the unknown. If I tell what's going to happen, I don't have the ability to work through that. So a lot of times people just don't talk about it. We do this in our everyday life, right? I'm just going to ignore this one thing and do what I do now because it's easier. So for the blocks that we've seen, I'm sorry, this one on the top is a little cut off. If there's a disability in a child, they are a huge risk of victimization. First of all, are kids with disabilities. And it doesn't have to be a physical disability. It could be a cognitive disability or anything like that. If you have a nonverbal child, that's a huge block for them to disclose because they don't have the language. The biggest ones that we see are familial induced blocks and then perpetrator induced blocks, followed very closely by us, the mandated reporter of what we do once we get that information. So familial induced, having a non-supportive caregiver. The number one reason kids will recant their initial disclosure is if they do not have a supportive caregiver at home. And this is a huge deal. And so we've incorporated a lot of those questions in our initial screening is who is believing this child? Who is at home taking care of this child? Do they believe them? Are they just not going through the actions of being compliant and cooperative with the investigation, but do they actually believe this child's disclosure? And if they don't, we need to get this kid in an environment where they are met with someone who believes what has happened to them. The perpetrator-induced blocks are typically threats, bribes, coercion, things like that. And threats can happen very explicitly, them saying to a child, if you tell, I'm going to kill you, or if you tell, I'm going to kill your dog. Those are real things, especially if that's an environment where there's domestic violence or interpersonal violence, because the kid has seen that. They know that that is a capable thing to come true. The other thing is the threats, like if you tell, I'm going to go to jail and you're not, or if you tell they're going to take you away, we hear it all the time. Those are real things for kids. So we can never put past a threat to not tell. We have to take this very seriously because they're very serious to kids. So then what do we bring, right? What do the mandated reporters bring to a potential block? If we try to push a kid into disclosing when they're not ready, right? That really shuts a kid down for further investigation. And then also the setting. Where are we at when we're talking to these kids? Is it supportive or is it unsupportive? Police station versus the Children's Advocacy Center. And then any other special needs. Language barrier is huge. Do they need an interpreter? Are they understanding what I'm asking them? Am I using child developmentally appropriate questions? So all of those things can be compounded into preventing a child from disclosing, one, but also once they are disclosing, preventing that full disclosure from happening. So the likelihood of disclosure, we talked a little bit about depending on what process and what stage they're in and how their disclosure comes out on the likelihood of them continuing on with that disclosure or not. But these are some really good kind of in a nutshell tips on the more likelihood of a child disclosing or not. Again, if they have a supportive caregiver, let's say they make a disclosure to mom, mom says, I believe you, and makes a report and does the appropriate steps and then is continuously supportive through that process, that child is a better chance of being resilient through their disclosure and also coming out on a healthy end of the investigation experience. Typically, kids who come from a structured environment are more likely to disclose. The distance of the relation to the offender, this one's huge. So the closer the relationship is with the offender, the less likely they are to disclose. But if you move that relation further away from one another, the more likely they are to disclose. So for example, a stranger assaulting a child one time, because the number of times of offenses also matters, that child is probably going to immediately tell somebody. But if you have an uncle who abuses a child every other weekend for 4 years, that child is less likely to tell because that relationship to the offender is closer, and there are multiple incidences of abuse. So that's just something to keep in mind. And then typically our female victims tell more likely than our male victims. However, the data in the last couple of years is showing that our male victims are telling just as frequently as our female victims. So the less likelihood that they're going to disclose, obviously, if they don't have a supportive caregiver, if they make an initial disclosure and that person goes, what? We don't talk about that, or that can't be true, you're lying. That is immediately going to shut a kid down. If that relationship is really close, so if you think about the statistic I told you earlier about 90% of our alleged offenders are family members or caregivers, that's a close relationship. So automatically, just based off of who our perpetrator is, kids are less likely to tell about it. If there's multiple incidences, if it's chronic abuse over years and years or multiple incidences at a time. And then this one's really interesting. If the child has previously made an attempt to disclose before, and that previous disclosure, nothing happened, whether that it was a lack of support from the caregiver or it wasn't reported, or nothing came of that report. Let's say it was reported and investigated, but because of the dynamics of abuse and neglect, it wasn't able to be prosecuted. If that child is victimized again or has other incidences that they need to tell about, they're less likely to talk because of what has happened before when they tried to tell. And then obviously if the perpetrator uses any threats or bribes or coercion, the child is less likely to talk about it. So why is it important that we know all of this stuff, right? Why do I need to know how a child processes trauma? Why do I need to know what stage they might be in? Because it matters, right? If we don't anticipate that there are layers and variables and things that are affecting a child from disclosing their abuse, we can't meet them in a trauma-informed manner. It helps us understand maybe where they're coming from a little bit. That if I ask, if a child says something to me and he makes a disclosure and I say, well, tell me more about that. And they bundle up, they get quiet, they don't talk. Oh, maybe they're in the tentative stage of disclosure. Maybe they're just not ready yet. I'm not going to push them anymore. So it helps us understand where they're coming from. It helps us explain the behaviors we might see from a child, the example I just gave. But it really just helps us understand how that trauma has, been encoded in them, and then how we might potentially either successfully get additional information or not. I think there's a ton of research in regards to the neurobiology of trauma and how trauma is encoded in the brain, how memories from traumatic events are encoded, how we retrieve those memories out of our brains. So one of the things that I was reading recently was talking about blackouts. And if you are blacked out, that information during the blackout never gets encoded in your brain at all. So if you think about some cases where maybe alcohol was involved, where kids are blacking out, and then we're attempting to get information from them about that experience, they don't have it to give. And if we don't understand that, if we don't understand how trauma is encoded in the brain, then we're doing a disservice by continuously talking to them, asking them questions, pushing them beyond their abilities. Because real life child abuse, specifically child sexual abuse, and disclosing of that is not CSI. It's not Law and Order. It's not going to look like that. It's messy and confusing, and there's a lot of misunderstandings. So we can't expect information from kids just because we think there's a suspicion. We have to understand what's going on with them. And doing that will allow us to be more trauma-informed moving forward. So how are cases being investigated now? We are working as multidisciplinary teams in our communities. This graphic really shows all of the different agencies together once an investigation is started and once calls are made in to report abuse and neglect. And then on the other graphic is the efficiency of the Child Advocacy Center, which is our program where I work, and just the number of kids that we're impacting, but more importantly, the feedback from the caregivers and the families. So we have a higher prosecution rate when cases are brought into the CAC, which is huge. But the other thing is that families feel more supported when cases are worked through the CAC. They have quicker access to medical care, quicker access to mental health services, and they are kind of have that wraparound services of coordination with everybody in the community. So these last two slides are probably going to be the most relevant for you all in regards to things you should do when a child discloses abuse and things you should not do when they disclose abuse. The biggest thing if a child decides to disclose to you is to meet that disclosure with belief. Even if you feel like, no, this is, hokey, I don't think it's real, you don't need to display that to the child. That doesn't need to come across at all, because disclosing, that initial disclosure from a child is the most reliable piece of information the investigation goes off of. And if you as a mandated reporter do something to muck that up, that prevents the investigation from moving further on. So we need to be very cognizant of how we handle that initial statement. So we need to stay calm and in control of our feelings. If you don't have a very good poker face, then you need to get one in regards to disclosures, because kids can read us, right? Kids can read adults pretty well. And so we need to not have any kind of reaction on our face showing when they disclose abuse to us. Because that's sending them a message. If we meet that disclosure with disgust or shock or anything like that, we're basically telling that kid, that's something we don't talk about. So we need to make sure we're in control of all of those things. We need to listen very carefully to what the child is saying to us. And the reason I say that is because as a mandated reporter, you are going to then have to tell or report what that child said. And if you weren't listening, and if you weren't even able to write it down, you may paraphrase, you may surmise, you might use words that the child actually never said, and all of those things are problematic. So we need to listen very carefully to what the kid says, and then report what they say verbatim to the appropriate authorities. If a child discloses to you, it is 100% okay to tell that child right then that the abuse was not their fault, right? Some kids, when they make that initial disclosure, because again, it's scary, need that reassurance to continue disclosing further on and moving through the investigation. So I absolutely believe that it is okay to tell a kid that what happened to them is not their fault. Depending on the age of the child, letting them know that you're going to tell someone about what they said is also very important, especially if it's an older child, because the last thing you want to do is to make them feel that they don't have to tell anybody else about it, or that kind of their disclosure is done and over. Because if you don't let them know that you're going to make a report, and then 2 days later they have to go tell someone about what they said to you, and they didn't know that, they're going to feel blindsided. They're going to feel that mistrust is going to be there. So sometimes people ask about, well, what language do I need to use to tell them I'm making a report? And it can be as simple as, what you said to me is very important, and I need to tell someone about that to help keep you safe. You don't have to say, I'm going to call the cops. You don't have to say, I'm going to tell the you're going to go to court. None of that needs to happen. Just that you're going to tell is important. And if you have the ability to give the child privacy when they're talking to you, I would encourage you to do that, because they're taking a risk by disclosing what's happened to them, and they've chosen you for a reason, probably because they trust you. And so we need to respect that disclosure back to them and give them privacy. Things you don't want to do. I talk a lot about this because we might not purposefully feel that we want to mess anything up, because again, what we do in the beginning matters in the end. There are things that mandated reporters do to kind of cause problems. So we don't want to be asking kids direct questions about their disclosure. If the child discloses abuse to you and you have a suspicion, you immediately need to report it. You don't need to investigate that suspicion. You don't need to know all the details about that suspicion. You just need to report it. So we're asking mandated reporters not to ask any additional direct questions about the abuse, because that happens later during the CEC and the forensic interview. You don't want to make promises you can't keep. This one's huge. If a child makes a disclosure, you don't want to say, well, I'll promise that never happens to you again. You can't promise that. Nobody can promise that. Whether that's with the same offender or 5 years down the road, someone else abuses them. You just can't make promises you can't keep. Don't want to push them into giving details about the abuse, because they might not be ready to go there, right? If you think about the disclosure process, they might be in the denial or tentative phase. And if you push them, you might create a false disclosure from the kid. You might cause a recantation from the child, or you might get them to a place where they don't want to tell anybody about it. And it's also could move you into an area of being leading and suggestive. And what we know about young kids who don't want to do anything that's outside of your role. I think that's the other thing for mandated reporters is like, stay in your lane, right? Know your role, and your role is to hear a disclosure, have a suspicion, and report it, and not have to do any additional investigations. That will happen later and will be done by the appropriate people. Don't discuss the disclosure with people who don't need to know. I think that's a big one. Obviously, you don't want to be on the water cooler or talking about what little Johnny said to you about their uncle, just because it keeps everything really intact in regards to the investigation. Because let's say a child discloses to you, you make a report, they end up accepting that and start an investigation around it. But in that meantime, you've also told your supervisor, you've told your coworker, and maybe you've told one other person. All of those people potentially could be subpoenaed for the court process. So you need to be very careful about the information that you're giving once a child discloses. So as a mandated reporter, it's paramount that you know what the state statute is in regards to being a mandated reporter. Who are they? Essentially, a mandated reporter, at least in the state of Virginia, is anybody who has a profession or a career or a job that is directly providing care for a child. So the obvious ones are teachers, daycare providers, doctors, counselors, mental health professionals, youth group organizations, sports directors, anybody that at any point has a child in their service delivery is a mandated reporter. So you all are mandated reporters. I feel that every adult should be a mandated reporter, regardless of profession. There are some states that do that, but for Virginia, there is a very specific list of who mandated reporters are. As a mandated reporter in the state statute, you have 24 hours to make a report upon receiving a suspicion of abuse. And it specifically says suspicion. You don't need to know that it's true. You don't need to know that it happened. You don't need to know the details. All you need to have is a suspicion, and then you need to make a report. This one, that's huge, because I think a lot of times mandated reporters feel like they have this huge responsibility of like, do I call? Do I not call? I'm not sure. Is it? I don't know. I don't really know a lot of information, so I'm just not going to call. That's detrimental. And there's huge case studies showing how not reporting can be problematic, and it could also create more victims. The Sandusky case is a big one, and then the Larry Nassar case is a huge one. Those two cases took years of people reporting them before something happened to them. And I think it's because what happens with mandated reporters is we typically default to truth, meaning that until we're met with all of the evidence and all of the information, that at no point can we say, well, I guess it did happen, we revert to maybe it didn't. And that's just a thing humans do. So all you need to have is a suspicion. And I think that will alleviate some of that burden and responsibility of having to make a report. When you make a report, you call law enforcement, or you call social services, or you call both. I think if you're doing diligence, you could definitely call both and be totally fine. But if you don't call both, and both are accepted criteria for investigations, they're going to be working together anyway. That's part of that MDT process, is all of those agencies are working investigations together from the very beginning all the way to the end. So if you call social services and it's an abuse that has potentially a criminal component, they're already working with law enforcement. The only time that you wouldn't call social services to make a report is if it's child on child. The child makes an allegation that the person who inflicted the injury or did the abuse was another juvenile, and they weren't in a caregiver role, then that would solely be a law enforcement issue, not social services. Something really neat just happened this last week. The Virginia Department of Social Services has created an online mandated reporting portal. So what that means is that prior to this portal, you'd have to make a phone call into DSS to make an allegation of abuse. Now there's this online submission process. If you go to the website, all you have to do is you have to create an account in which you can create an account. And then whenever you have a concern of abuse or neglect, you go online and you submit that allegation, or you submit that concern that you have. I personally have not tested it out yet. It's brand new, so I'm not sure how it's going to work, but I am pretty excited about it because I think it's going to give mandated reporters another way and another modality to make reports if they can't make a phone call or worried about making a phone call. The other thing I'll say about mandated reporters for you all is that you do have the option to stay anonymous or not when you call in a concern of abuse and neglect. As a mandated reporter, I would implore you to leave your information, because if you don't leave your information, then nobody can follow back up with you, right? If it's anonymous, nobody knows who to get back in touch with for additional information. The other reason you want to leave your information as a mandated reporter is a check and balances. If you're a mandated reporter and you make a report and you leave your name, at no point can anyone come back to you and say, well, you had a suspicion, but you never called. Yes, I did, because I left my name on the report. So just as kind of a CYA, I always tell mandated reporters to leave your information when you make the report and don't leave it anonymously. There's a question about the child-on-child issue in reporting. So let me see, I'm going to go back really quick. So, so the example is that the offender was a minor, so they're curious if they should have called police. So it's interesting. With social services, they have very specific criteria on cases that they can accept. The biggest one is the child under the age of 18. was the abuse perpetrated by a caregiver, someone in a caregiver role? So if it's a child-on-child case or juvenile-on-juvenile case, and that offending juvenile was not in a caregiver role, social services cannot take it. And what that means is that the only time I've seen social services being able to get involved in juvenile-on-juvenile situations is when the caregiver, the grown-up, was aware of the abuse occurring between the two juveniles. Otherwise, it's strictly a law enforcement because it doesn't meet their criteria as that juvenile being in a caregiver role. Now, if you have a 17-year-old babysitting a 5-year-old and that babysitter was given authority to care for that 5-year-old, and then that 17-year-old did something to that 5-year-old in the time that they were a caregiver, then social services would get involved. So the juvenile-on-juvenile areas of cases can get a little tricky. The thing to know is that in those situations, what I would encourage you to do is to call both agencies. Social services may say it doesn't meet our criteria because they're not a caregiver, but then you can easily call law enforcement, especially if it's a sexual abuse case, to get involved with. Hopefully that answered a question for you. If not, we can circle back at the end. So the bottom line with all of this is that we need to be listening to a child's disclosure and making a report right away. We also need to be staying in our lane. Know that how cases are worked in our community is that if an investigation is reported and begins, a full interview will happen at the CAC with a forensic interview. All of those details will be received. Law enforcement will do their piece, social services will do their piece. So all of the things will happen later on down the road. Mandated reporters have a super crucial role in the beginning to ensure that the disclosure is captured in a trauma-informed manner and reported. And then from there, everybody else will it's almost like a relay race, right? And every leg of the race is a different entity. And so our mandated reporters start the race and then they pass the baton off to the other people, et cetera, et cetera, et cetera, until we finish the investigation. And so I think as coming from someone who was a mandated reporter, also from the CPS side of things, I understand and I empathize that it is frustrating when you make calls into DSS and law enforcement, especially when you have that feeling that something is happening. And let's say it just doesn't meet criteria for them to open a case, not because they also might not think anything, but just, red tape, all of the things like that. And then even moving a case further on down the road with law enforcement and prosecution. Sometimes cases don't happen with prosecution because they just aren't able to move it forward. And that's frustrating and it's upsetting. But that's why the community, way we're investigating cases, is kind of that macro approach of wraparound agencies doing everything they possibly can to ensure that if, let's say, prosecution drops, at least that caregiver and that child have mental health services to move them forward through their healing process of their trauma, or at least getting the medical care they need. So there is positives to our process, but I understand that there are also frustrations a lot of the time. And also just keeping in mind that everything we do needs to come from a best practice approach and what's in the best interest of the victim child in that moment when we're interacting with them. All right, so that's kind of the meat of the presentation. We have a couple of learning objectives that you all need to answer. So if you just want to drop your answers in the chat, that will help us and then we'll discuss. So how many hours do mandated reporters have to make? How many hours do they have before they have to make a report of suspected abuse for the state statute? Yep, you guys all got it right. Everybody's 24 hours. It used to be 72 hours. And quite honestly, it should not take mandated reporters 24 hours to make a report. It literally should be happening immediately after that disclosure is made. The other thing I will say to that point with mandated reporters is that if you are the person that heard the disclosure from a child, you need to be the one making the call into DSS, not somebody else, because then we have this game of telephone happening, right? And things can be messed up and confused, paraphrased, etc. If you heard the disclosure, you need to be the one making the report into DSS. Okay, when responding to a disclosure, you should do the following. Make promises about what will happen, listen to what the child is saying and report it if it's suspicious, call the alleged offender to see if the child's statements are true, question them until you have all of the details. Yeah, you guys got it right. It's B. And interestingly enough, I didn't realize I made both questions, the answers were B. That was not by design. I think it's really important that not calling the alleged offender. Sometimes we have that happen. The mandated reporter calls, maybe not the alleged offender, but maybe they call the caregiver, right? The other person, and tells them what the child said. Well, we don't know if that caregiver is supportive or not. So we don't want to be doing anything before we make a report to DSS or law enforcement. They'll be the ones to kind of notify people and let people know. I also hear a lot of times from mandated reporters of like, well, they're going to know it was me that called. They might know it was you, especially if that child doesn't go anywhere else, right? And isn't around any other caregivers. And then they took them to an appointment, and then the next thing they know, they got a call from DSS. Caregivers might figure out who it is that called it in, but just know, and I understand that might cause barriers because especially if you're trying to continue that client physician relationship, but just know that making the call is the right thing rather than not making that call. All right, so these are a couple of my resources in regards to information and just further data about child abuse disclosures or how children tell. So let's take a couple of minutes here at the end and just go through some questions. I see some coming through the chat. We've got someone who from Amy, works in primary care. If a family comes in with a concern of abuse, which is not within the first 48 hours, can we refer them directly to the CAC and not the ER for forensic nursing? Yeah, so I think that's huge. So if you have a concern that comes in, your first step is to call law enforcement or social services. Those agencies then make a referral to the CAC. We don't accept referrals from anybody outside of law enforcement and social services. I think that's huge. We need to ensure that there's an active investigation, and we need to ensure that there's an open case. So the streamline of the process is disclosures made, mandated reporter calls social services or law enforcement. If the case is accepted and meets the criteria for a forensic interview, they will be referred to the CAC. If it's a sexual abuse disclosure, you need to call right away. And I would encourage them to, if it was something that happened in the last 120 hours, going to the ER for a forensic medical exam. Their hours of evidence collection was bumped up to 120 hours. So if it was something that happened immediately, let's say the day before or the last couple of hours, the first thing they need to go is to the ER for a forensic medical exam. If it was outside the 120 hours, definitely calling law enforcement and social services to make the report. But I understand sending them to the ER, especially right now with things that are happening, can be problematic. But the first point of contact needs to be a report to social services and law enforcement. The other question we have, let's see. Yeah, so old disclosures, right? So we talked about sometimes it takes people years and years to make a report. If it's someone disclosing abuse that occurred years ago, and the child is still under the age of 18, I would still call social services. But if it's an adult disclosing abuse, you want to make a call to law enforcement about that. And what do you do with a disclosure of rape from a person over the age of 18 who doesn't want to report? That's an interesting dynamic, right? Because it's not a child technically per se, but I think having conversations with them about maybe their hesitation to report or not report is important. If you have a good client-physician relationship with them, having that conversation. And maybe it's you're setting up a resource for mental health services and counseling for them to work through or process however they want to process that. But if it's an adult, I'm not sure that calling in a report for an adult who's not wanting to move forward with the process is going to be beneficial for them, especially if they're not ready. So it'd be more of having conversations about doing what they need to heal. And typically that's the mental health referral moving forward. But I don't think you're mandated per code as being a mandated reporter for anybody who's an adult to make a report or not. And it may be for those people who have waited to disclose. They're just kind of tipping their toe into that whole world. And so maybe they're just saying something to see what the reaction is going to be. And if the reaction's met with support and care and belief, it's genuine, more than likely they might move to an area of wanting to make a full report. One of our jurisdictions worked a case that was 40 years old and had successful prosecution with an adult who disclosed abuse by a neighbor 40 years ago. And it just took them that long to tell. So I think if you're dealing with adults, having more conversations about what they need rather than we need to get, criminal valid, outcomes. It's just more about what do you need to feel good or to feel better about what's happened to you. Another question has been, I've also been telling or at least notifying the parent that's brought the child in who that you're making a call to CPS. Should I not? I think, so a lot of these questions are met with it depends. You don't know if that person who brought the child in is supportive, right? We don't know if they're 100% supportive. They might appear supportive. They might be cooperative with us. Maybe they were the ones that had the concerns in the first place, but we just don't know if they're supportive or not. So if with that and knowing that that's such a huge piece of why kids recant and are unable to move forward in the investigation process, unless your policies strictly dictate that you have to, I would suggest not telling them you're making a report because again, we just don't know if that caregiver is supported. So Dawn chimed in with the 120 hours. It is also Forensic Nurses Appreciation Week this week. So if you know an FNE, or even if you don't know any of the FNEs over in Carilion, please go thank them for the work that they do this week. Yes. So question was, how does the CAC get information from a child who may be in the denial or the tentative phase in regards to not making it more traumatic for the child? So the beauty of the CAC and the forensic interviews is we meet the child where they're at. So, and we do a lot of techniques in the interviews about building rapport and kind of assessing the child. And we just take our time. I think if, we ask the child, what brought them in to talk today, and they say, oh, it's something I said about my dad. Oh, well, tell me what's going on. I don't want to talk about it. We don't make them talk about it. We ask about what makes them unsure of talking about it. We might explore kind of their reasons and their feelings around why they don't want to talk about it, but we don't make them talk about it. What that child is telling us is they're not ready. So we set them up with mental health counseling and other referrals for support. to get them to a place where when they are ready to talk about it, they can come back in and share their information. But we don't ever move a child from tentative or denial into active disclosure if they're not ready. And the investigative MDT understands that as well. We don't ever want to push a kid. What I'll leave you all with is know that the process, even though it's not perfect in regards to reporting investigations of abuse and neglect, it's much further along than it was 5 years ago, 10 years ago. We have come leaps and bounds of how this community is responding to investigations of child abuse, and we're continuously learning. And so the investigative process is a very close-knit group. We're always talking about how to improve. So if there are things that are happening that either you're sensing from a mandated reporter end or you're hearing feedback from caregivers, let us know, because there aren't things that we can fix if we don't know about them. And I think it's all about how to improve this for the kids who are disclosing abuse moving forward. And hopefully you all got some information this morning that'll just make you feel a little more trauma informed about handling a disclosure, and also feeling more confident about what to do with that information. So thank you all for joining me this morning. And I'm pretty sure you all have some surveys you need to fill out after the fact. So thanks for joining me. And if you guys have any questions, just shoot me an email.